For patients who get anxiety when starting TRT, does the wired feeling or anxiety fade after a few months?
Okay, I like this question. So it's going to massively depend on the individual, but does it fade? Yes. Does it fade down to nothing? It depends on if the individual has underlying issues with anxiety. So testosterone is not a stimulant per se. It doesn't fall into the category that would identify it as a stimulant, but it stimulates the central nervous system, especially when someone is naive to the dosing. So when the body gets an acute spike in testosterone, whether they're initiating TRT or when guys are doing cycles of anabolics, for example, it causes more activation of the central nervous system. The problem is that if someone is predisposed to anxiety, what feels like activation will then lead to an anxiety response. I use the analogy that, and it's a in the sport of boxing, it doesn't make any sense why these two people would be fighting. But if you took two boxers, one who'd won every fight and one who'd lost every fight, and they went into the boxing ring together, as they're walking out and the music's playing, they're both going to have the same physiological sensations of anticipation, which is butterflies in the stomach, shortness of breath, elevated heart rate, all of that stuff that's very normal. But the guy who's won every fight will associate that with victory and excitement and, positive anticipation. Whereas the guy who's lost every fight will associate that with failure, pain, losing, embarrassment, humiliation. But physiologically, they're the same. So if someone is predisposed towards anxious thinking and has an anxious thought process, then this is definitely going to be something that is going to potentially be uncomfortable for that first few months of treatment. So the things that I find that are very helpful for that period, CBD oil works very well. We often recommend it for my clinic in Australia. Magnesium works well. Phosphatidylserine works well. I've done lectures on all these supplements on the channel. Those ones work really well, as well as if people are drinking coffee or caffeine, combining it with theanine can help to take the edge off. But this can also potentially, if it doesn't fade and resolve, be an indicator that the dose is too high. So it is very important that the individual gets that blood test at about 8 to 12 weeks when the provider orders the first blood test, I would hope, which is when levels reach a stable concentration to make sure that the dose is correct. And sometimes guys who are more prone to anxiety, because sometimes testosterone helps with anxiety, sometimes it makes it worse, and it depends on where it's all coming from. But sometimes guys who are feeling like cranked and like wired, like jacked up in a bad way, sometimes they do better starting with the dose a little bit lower and then titrating it up very gradually every 3 to 4 months, rather than shooting straight for a higher level, because their nervous system and their psychology needs time to adjust. So yes, it does back off once your body gets used to it, assuming the dose is correct, but a baseline anxiety state can be exacerbated by higher androgen levels. And that's why it's also important that the root cause of the anxiety is addressed. I like things like mindfulness meditation, martial arts, stretching and mobility. All of these things really help, as well as looking at different forms of cognitive behavioral therapy, how we think and how we look at things. And sometimes it actually helps for guys to speak to a therapist, which I know gets a bad rap, but sometimes it is helpful. So it's important to look at it holistically.